Welcome to Southern Cancer Center. We are honored that you have entrusted us to care for you. We understand that a visit to a cancer center can be very scary. We hope this video helps to answer some of your questions and allay your fears. When you walk in the doors at Southern Cancer Center, you will be greeted by a warm smiling face and a member of our team that's very anxious to help you on this journey. After you complete your registration, the next stop is in the lab. Typically we do blood pressure and weight checks, and if your physician has ordered blood work, they would also draw blood work at that time. After the lab, you'll be taken to an exam room where a member of our clinical staff will come in and ask some questions pertaining to your health history, what medications you may be taking, and allergies, and this is just to help us get a very complete picture of your current and past health as we are setting a treatment plan for your diagnosis. After our clinical team has gathered all of the relevant medical history, your physician will come into the room and have a discussion with you about the diagnosis, the extent of any disease, and together you will work to formulate a treatment plan that is tailored to your diagnosis.
With the first meeting, one of the main things I'm trying to establish is that the patient feels comfortable with me and with my staff. Most of my patients, the first meeting, of course, they either getting a diagnosis of cancer when I'm meeting with them or have gotten one recently. They are certainly in shock to some degree. Most people probably remember less than 10% of the first meeting.
I am a fanatic about how we communicate with patients and that we respect their time, and we respect that even though the things we're telling them may seem routine to us, the smallest thing like a lab value or moving an appointment can be monumental to the patient. So we have to respect that, and we have to deliver that information in the right way.
I like to tell people to trust their instinct and to question how they feel and to be very much in communication and make sure that you understand what you're going through, what's going to happen. You're not just a patient, you are definitely a person that they do care about.
Southern Cancer Center is a wonderful institution, and I would tell everyone, if you're having any kind of problems, come here. The doctors, the nurses, they're so nice.
My first appointment, they made me feel at ease, made me feel better, told me what we were going to be doing. Every step of the way I was instructed, and that's helpful too, so there's no surprises. You know, I'm going to be doing this for the following reason. I didn't have to ask the questions, and so that was very helpful to me, very helpful. I would actually recommend Southern Cancer Center, and it was a delightful surprise because perhaps there's a feeling that one has to go out of state to get the big name cancer centers, and I don't feel that to be the case. I felt like I got care here as well as you can get at any of the other big, well-known cancer clinics in the nation.
People choose Southern Cancer Center because we have been established in this community for many years. Our physicians have a reputation of providing the highest level of care in this community. I think our reputation precedes us. We have a great staff here. They're all very friendly and loving, and we truly do treat our patients like they're our family. That's something that's not easy to replicate, and that leaves our patients with a sense of belonging and that their care team truly does care about their outcome and their journey through diagnosis to recovery.